In today's lecture, I'm going to discuss the paracetamol poisoning, which is also called as acetaminophen poisoning, commonly seen as Panadol poisoning. So, paracetamol it is used as antipyretic, analgesic properties, and having also mild anti-inflammatory effect as well. So, paracetamol it is used as antipyretic, analgesic properties, and also mild anti-inflammatory properties. The paracetamol it is very safe drug in low dose, but if the dose increases, so it is one of the most lethal drug as it could cause the liver damage and renal failure. So the normal dose of paracetamol that is 2 to 3 gram per day. The safe dose and the normal dose of paracetamol that is 2 to 3 gram per day, but if the dose of paracetamol exceed from 15 to 20 gram per day, in that case it lead to toxicity. So the normal dose is 2 to 3 gram per day, but if the dose is increased from 15 to 20 gram per day, then it lead to toxicity. So let's say if we have a 70 kg man, so 70 kg man consists of 10 gram paracetamol. 10 gram paracetamol it is equal to 20 tablets of paracetamol of 500 mg dose. So let's say if we have 70 kg man, that will be equal to 10 gram paracetamol, and that will be equal to 20 tablets of paracetamol of 500 mg. So if the patient taken the 20 tablets of paracetamol at the same time, that case it would lead to toxicity. So what is the physical appearance of paracetamol? So it is odorless. Paracetamol is odorless and having better taste and white crystalline structure. So it is odorless, better taste and white crystalline structure. Paracetamol it is available in the form of tablets. It is also available in the form of oral suspensions, mainly in pediatric age group patients. Also, it is available in parenteral suspension like in the form of IV and IM. So, what is the mechanism of action of paracetamol overdose? So, in the liver, we have a specific substance that is called as glutathione. Glutathione is present in liver and it has protective effect on liver. It has protective effect on liver. Glutathione is a specific substance which is present in liver and it has protective effect on liver. So what happens in paracetamol overdose? In paracetamol overdose, there is a substance produced that is called as NAPQI. That is, what is NAPQI? That is N-acetyl para-benzoquinone amine. So as a result of paracetamol overdose, it produces a specific substance and that specific substance is known as N-acetyl para-benzoquinone amine, and this N-acetyl para-benzoquinone it destroys the glutathione. So once the glutathione get destroyed, so there will be decreased activity of glutathione in liver. Once the glutathione activity get decreases in liver, so it may lead to susceptibility of hepatic necrosis. So that's how the paracetamol overdose it lead to hepatic necrosis. I repeat, the glutathione has a protective effect on liver. So in a result of paracetamol overdose, it produces a specific substance that is NAPQI. That NAPQI, it destroy the glutathione in liver and decrease the level of glutathione, lead to the hepatic necrosis. So that's how the paracetamol poisoning, it lead to the hepatic necrosis. Now let's talk about the clinical features. So initially there is nausea, vomiting, and right upper quadrant pain, but later after 24 hours it may lead to liver damage and renal failure. Actually, the clinical features of paracetamol poisoning, it is divided into different stages. So based upon those stages, it is divided into four stages. That is stage 1. So in stage 1, there is nausea, vomiting, and malaise. While in stage 2, there are no symptoms, but there is liver cirrhosis, and often there is increased or elevated liver enzymes. So in stage 2, there are no symptoms, but there is liver cirrhosis and there will be deranged and elevated liver enzymes. In stage 3, there is hepatic necrosis, also hypoglycemia and hypothermia. While in stage 4, it is recovery phase. It is recovery phase. So there are four stages. There is in stage 1, there is nausea, vomiting, malaise. In stage 2, there are no symptoms, but there are elevated liver enzymes and liver cirrhosis. In stage 3, there is hepatic necrosis, hypoglycemia, and hypothermia. While in stage 4, that is recovery phase. Ask the patient or relatives of the patient that whether they had taken the paracetamol like substances or not. So that will also give you a clue. So ask patient or relatives whether they had taken paracetamol like substance. That will also give you a clue. Also, their serum paracetamol level is important. Serum paracetamol level can be done. That serum paracetamol level, it is done after 24 hours of poisoning. Okay, so the serum paracetamol level is important, but this serum paracetamol level, it is done after 24 hours of poisoning, and this serum paracetamol level, it will show the prothrombin time elevated, and this is the prothrombin time, which is the most sensitive indicator. It is the most sensitive indicator of liver injury. So the serum paracetamol level done after 24 hours of poisoning, the increased level of prothrombin time, it is important, and it is the most sensitive indicator of liver injury. Also, the LFTs are raised. LFTs and serum bilirubin, it is raised, but that raised slowly. So the most sensitive indicator is PT. There are few guidelines for the treatment options. The first is that is antidotal treatment, and there is supportive treatment, and there is proper counseling of patient. So that how we will treat the paracetamol overdose. That is, for that we have a few guidelines. The first is antidotal treatment, the supportive treatment, and the counseling. Say if a patient presented with you in paracetamol overdose case within 1 hour, so within 1 hour, if patient presented with you within 1 hour of acute poisoning of paracetamol, so in that case we will do gastric lavage, that is stomach wash. But if a patient comes to you within 4 hours, then we will do then we will give activated charcoals. So it's important, if the patient comes within 1 hour of presentation, in that case we will do gastric lavage. If the patient presented within 4 hours of acute poisoning of paracetamol, in that case we will give activated charcoals. If there is concomitant vomiting, in that case we will give antiemetics. Now, in supportive treatment, how you will in supportive treatment, if the patient presented with hypoglycemia, so we will give 5% or 10% dextrose. 5% or 10% dextrose. If there is hypothermia, so for hypothermia we can give dextrose as well. Dextrose. But if there is bleeding, so in that case we can give vitamin K and FFPs. I repeat, if there is hypoglycemia, give the patient 5% or 10% dextrose. If there is hypothermia, give the patient dextrose. If there is bleeding, then give patient vitamin K or FFPs. FFPs will give the immediate response, while vitamin K, it will give delay response. Antidotal treatment. So for the antidotal treatment, it is so important that this antidotal treatment it should given within 8 hours of acute poisoning. It is given within 8 hours of acute poisoning. So antidotal treatment it should given within 8 hours of acute poisoning. So this antidotal treatment, there are two options for it. The one is, that is N-acetyl cysteine, and there is methionine. Two options is antidote in case of paracetamol overdose. The first is N-acetylcysteine and the second is methionine. So which one is the most effective? The N-acetylcysteine, it is most effective and it is mostly given in eastern areas, and like in Pakistan or India, while in western countries the most commonly methionine is used. So the N-acetylcysteine, it is given intravenously, while methionine it is given orally, and the dose is 2.5 gram QID, and it is given orally, while N-acetylcysteine it is given IV. And the most important is that N-acetylcysteine it increase the glutamate it increase the glutathione level in liver and decrease the NAPQI. So the N-acetylcysteine it increase the glutathione level in liver and decrease the NAPQI, and this it prevent the hepatic necrosis. So how we will give the N-acetylcysteine? So how to give N-acetylcysteine? So it is given in different doses. First is 150, then 50, and then 100. That is mg per kg. So initially it is given in 150 dose. Initially N-acetylcysteine it is given in 150 dose and 200 ml of glucose Later, it is given in 500 ml glucose, then in 1 liter of glucose. So initially there is 150 dose in 200 ml glucose over 1 hour. Then we will give 550 sorry then we will give 50 mg per kg and 500 ml glucose over 4 hours, and then we will give 100 mg per kg and 1 liter of glucose over 16 hours. So it's important. It's all for paracetamol poisoning, and thank you so much.